Hello, welcome back. The topic today is sweet craving. How to avoid sweet craving or the sweet people come and ask us, doctor, I have a sweet craving. I have a sweet tooth. And I feel like eating too much of sweet. So check me for blood glucose or a diabetes and all. They'll ask why people have sweet craving. First, we should understand why sweet usage generally means sugar, or you can say carbohydrate, or in the simple term, glucose. So, glucose, sugar, carbohydrate, or any sweet is called the craving is called sweet craving. So, why people have this craving? First, we should understand sugar is very essential for our a normal function of the body. So, whatever we eat, whether you take vegetables, you take biryani, you take sweets, you take nuts, everything goes in and digested, and it's broken down into simple sugars. These simple sugars are the one which can go into the cells. Like, so we have a brain, we have a heart. How do they get their energy, or how do they get their the nutrients? Is the brain, the cells, or any, for that matter, any cell can accept only sugar and oxygen. So whatever we eat, even if it's a fat, it's converted into simple sugar, and that goes into the cell. And anything more than that sugar, again converted into fat. Excess sugar is converted into fat. So sugar is very, very, very essential, or carbohydrate is very essential. Okay. Then why we get cravings? That is very, very important. Nowadays, with the lifestyle, the first and foremost the thing is late night sleep. Suppose somebody sleeps by 9 o'clock, 10 o'clock, mostly they will not have that kind of craving. They will avoid the sweets. Now people are living alone, with the lights and gadgets. People go for late night sleep, especially the evening time. They will have some snacks. So they like Maggie or anything. So they think the Maggie is not a food. So by 10 o'clock, they have that craving to eat something else. They think they ought to eat something else. So they eat. So this is one reason. First and foremost reason is late night sleep. The second is always obesity. So obese, you got hyperinsulinemia, your steroid levels are high, so naturally you will get a sweet craving, or a likings towards carbohydrates. And people, when they're alone, they're stressed. So the loneliness is a boredom. So to the kill time, so they start eating food or any sweets, usually especially calorie rich sweets they will eat. So what happens? The blood sugar will rise. When the blood sugar rises very fast, it releases the endorphins, morphine like structures. I mean, inside the brain, they release endorphins. So they're all morphines. They reduce the pain. They'll give some well-being, temporary well-being. In fact, they'll give good sleep also. So when they get good sleep, they're addicted to these kind of sweets craving, or the sweets. They also can release serotonin, the happy hormone. Sometimes they can get happiness. So this is another reason. Or suppose somebody is under stress, depressed, and so the body produce a lot of adrenaline. So they produce a lot of insulin and steroids. So they crave for sweets. Another thing is, suppose girls, if they have a periods, they can have a sweet craving. Or somebody is pregnant, they can get sweet craving. So the body needs more calorie, the more endorphins to be released. So they will ask, and the body will push them to take a lot of sweets. So suppose somebody is diabetic. Again, suppose the diabetes, high blood sugar. The previous videos I told you, even if the high blood sugar, they will crave for sweets, because you need insulin to push the glucose into the cell. There is no insulin, so the cells will not get the sugar, though the sugar is high, but the cells will not get the sugar. So they feel like eating more and more, especially sweets. That's a sweet tooth they have. Or a diabetic on treatment, good control, the sugar is very low. So again, the cells cannot get the sugar, so they crave for sweets. So first we saw why we need sugar. Now why we crave for sugar and how to avoid. And first and foremost is always we say go to early bed. By 9 o'clock, hit the bed. That's the first and foremost. Suppose you go for the early bed, mostly we can avoid the snacks, the sweets, or whatever the high calorie diet we can avoid. This is number one. Number two, reduce your body weight. So obesity should be treated. So once you lose your weight, your hyperinsulinemia comes down, your steroids will come down, so the cravings will go. Third, avoid loneliness. Stay with people. meet people. So since you are alone, don't talk to them on the phone. You can visit them or you can be with them, so that the loneliness, when avoided, the cravings will automatically will go. And do some exercise, at least walking, 30 to 45 minutes of walking a day. Simple walking, you can yourself can feel the cravings for anything will come down. Cravings for anything, whether it's a food or some stuffs and whatever it is, the cravings will come down but just by walking. And next is, if you're taking diabetic medications, then take proper dose, proper time, and keep your timing of food in the correct time. So don't skip your meal, or don't overeat or undereat, but keep the time and medicine perfectly. And uh, don't keep long hours of empty stomach. So suppose you're working, suppose you have a lunch by 1 o'clock and you have a dinner by 10 o'clock. No, that should be avoided, because long hours of gap, your body will crave. Definitely that will push you to eat more calorie and more sweet calorie. Cravings for the sweets will come. And and but general people, suppose you're taken care of everything, but even then I have a sweet. Generally what we say is, one when if you're awake the morning time to night, usually you start taking food. By breakfast should be around 7:30 to 8 o'clock, and there should be a mid morning snacks by 10:45. The mid morning snacks usually means vegetable salad, fruit salad, or calorie less, fiber rich, kind of nuts. All these things should be by mid morning snacks. Then by 1 o'clock lunch, 4:30, around 4:30, some fiber rich or protein rich, like something like swindle, they can take that. By 7 o'clock, finish your dinner. So this is how it should be. And suppose and you feel like eating something, you're not getting sleep. By 7 you had a dinner but you're not getting sleep because of that. Maybe you can try some fruits like an apple that can solve the problem. And in spite of all these things, some people have, they have to eat something like a sweet. So instead of avoiding completely, but it's better to avoid completely. But if you have a craving, like cookies or chocolates, you have to eat, means instead of completely avoiding it, you can have it. But instead of one or two, you can have one fourth of chocolate to satisfy your sweet craving. This one. Or don't go beyond 150 calories. So whatever is the sweet or cookies or whatever you're eating, you should never go beyond 150. So if you have a sweet craving or sweet tooth, so look for what is the cause, and accordingly you can change yourself and take care of your sweet craving. Thank you.